Yellow fever continues to pose a significant threat in South America, particularly in Colombia and Peru, where ongoing outbreaks have triggered public health emergencies and raised alarm among health authorities. The World Health Organization and the Pan American Health Organization have issued stern warnings, urging endemic countries to intensify vaccination efforts, as the risk of yellow fever outbreaks in the Americas remains high. The urgency of these warnings cannot be overstated, as the disease continues to claim lives and strain healthcare systems across the region. In Colombia, a national health emergency was declared after a sudden surge in yellow fever cases. As of April 2025, the country has reported 74 confirmed cases, with 34 fatalities. The rapid spread of the disease has prompted the government to activate a large-scale vaccination campaign aimed at controlling the outbreak. This includes not only immunizing residents, but also ensuring that travelers entering or leaving the country are vaccinated. The urgency is clear. Vaccination is seen as the most effective tool in curbing the spread of the virus. However, while the government has mobilized over 8,000 healthcare professionals to combat the outbreak, the disease continues to spread in various regions, causing significant concern. In Peru, the situation is similarly troubling, with a rising number of yellow fever cases recorded since the beginning of the year. By April 2025, there have been 19 confirmed cases, a stark increase from just 2 cases reported during the same period in 2024. The cases have been concentrated in the regions of Huánuco, Amazonas, and San Martín, where the virus has already claimed 8 lives. Health authorities in Peru have declared an epidemiological alert, focusing on intensifying vaccination efforts in the affected areas. However, the country faces ongoing challenges in controlling the disease, particularly in rural areas where access to healthcare and vaccination may be limited. The persistent spread of yellow fever in these regions highlights the complex nature of the outbreak and the difficulties in ensuring widespread immunity. Historically, both Peru and Brazil have been hotspots for yellow fever, with the 2 countries accounting for a significant proportion of cases and deaths in the region. From 1960 to 2022, Brazil recorded the highest number of yellow fever cases, while Peru followed closely behind. During this period, over 9,000 cases were reported across South America, with more than 3,300 deaths attributed to the disease. Peru alone accounted for nearly 40% of these fatalities, underlining the severe impact of yellow fever on the country's population. Despite ongoing vaccination campaigns, the virus continues to pose a significant threat, especially in rural areas where vaccination coverage remains inadequate. The disease is transmitted by infected mosquitoes, and its symptoms can be severe, including high fever, intense headache, muscle and joint pain, nausea, vomiting, chills, and loss of appetite. In more severe cases, yellow fever can lead to hemorrhaging, liver failure, and even death. The alarming rise in cases in Colombia and Peru raises concerns not only for public health, but also for the broader regional stability, as the spread of the disease can affect international travel and trade. The situation in South America is compounded by the fact that many of the recent cases in 2024 were in individuals who had not received the yellow fever vaccine. This highlights a critical gap in immunization coverage, despite the availability of effective vaccines. The Pan American Health Organization has warned that yellow fever continues to be a major risk in the Americas, and while vaccination remains the most effective preventive measure, it is not a panacea. Control of mosquito populations, the use of repellents, and other vector control strategies are also crucial to containing the disease. The outbreak in South America underscores the ongoing challenges faced by public health systems in managing infectious diseases. While the region has made significant strides in vaccination and disease control over the past few decades, the resurgence of yellow fever highlights the vulnerabilities that remain. The failure to achieve universal vaccination coverage and the ongoing threat of mosquito-borne diseases serve as stark reminders of the limitations of current public health strategies. The response to yellow fever in South America must be comprehensive, addressing not only vaccination, but also the underlying social, economic, and environmental factors that contribute to the spread of the disease. Efforts to improve healthcare infrastructure, particularly in rural and remote areas, are essential in ensuring that all individuals, regardless of location, have access to the vaccines and treatments they need. Without such efforts, the region may continue to see periodic outbreaks of yellow fever and other infectious diseases, which can have devastating consequences for public health and the economy. While the emergency responses in Colombia and Peru are commendable, the fight against yellow fever is far from over. The persistence of the virus in endemic regions, the challenges in achieving widespread vaccination coverage, and the ongoing risk of mosquito transmission all point to the need for continued vigilance and action. As health authorities and governments work to contain the current outbreaks, there is a pressing need to ensure that lessons are learned and that long-term strategies are put in place to prevent future yellow fever outbreaks in the region. The stakes are high, and the consequences of inaction could be severe.